Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical. Thank you for watching this video. This is, as you guys know, this is kind of like my favorite topic is strange sensations. But we're going to talk about internal spinning, and it's a very, very common complaint, and it gets various diagnoses. So this was, one of our patients said, "Doctor, my whole body feels like it is spinning. It isn't the outside world, it is inside. I have tunnel vision in both of my eyes. I am afraid I am going to go blind. The peripheral vision is dark." Excuse me. "I also have these extreme smell sensitivities, like everything I eat has too many Mexican spices." Now, personally, I like Mexican spices, but maybe if all the food tasted like Mexican spices, maybe I wouldn't like it. But no, but often internal spinning isn't isolated. Normally people have other symptoms with it. And no matter what strange sensation you have, if you have other signs and symptoms compatible with upper cervical instability, for instance, tenderness, clicking, popping, grinding, maybe it occurred after a high velocity manipulation or a car accident, you have to think that the cause of it is upper cervical instability. Upper cervical and cervical instability has many different mechanisms by which it can cause dizziness or internal spinning. Now, internal spinning is different than lightheadedness or dizziness. Spinning we normally call vertigo. The world's going around, or inside they have an internal spinning, and it's almost always associated with a lot of nausea. Where even today I saw one of the clients there, they just had a constant complaint of lightheadedness or dizziness. But there's so much overlap between vertigo, ringing in the ears, lightheadedness, and dizziness. You really do have to think about them as a continuum. So this is cervical instability. So all of these things can cause dizziness, and certain of them cause spinning. So the most common things that we see that where somebody has internal spinning is where the cervical instability causes some kind of a decrease in the blood flow to the brain or the inner ear. So this is one of my favorite models. So we have an ear, sound goes through the ear, it causes the tympanic membrane to vibrate. Then the malleus incus stapes, which are the three little bones, the smallest bones in the human body, then they'll start vibrating, and eventually it goes to the inner ear. And the most common treatment for vertigo or Meniere's disease is where you go to a physical therapist and they'll do these Apley maneuvers to try to get rid of the crystals if there's crystals in the inner ear. Now, sometimes that's successful, and that's a great place to start if you have new onset vertigo. But a lot of times that doesn't really resolve it. And you guys have heard me many, many times, whatever your symptom is or your diagnosis is, and if nobody's given you a curative treatment, then you got to follow the neurology. So the neurology of the ear or the inner ear, it involves cranial nerve 8, which is the cochlear vestibular nerve. That's the main nerve that helps us with balance and making sure that this side of the body and this side of the body is balanced, so our eyes are horizontal. Like, we don't walk around like this, but when you have internal spinning, sometimes you got to get into a weird position, which is normally laying down. And then in that weird position, your gaze is better and the spinning goes down. So it shows you that the vestibular cochlear nerves are sensing different things. So that's cranial nerve 8. However, if you have Eustachian tube dysfunction, so you see this thing right here? In other words, there's a connection between the ear, the inside of the ear, and your throat. So when you go up or down in an airplane, there usually is a point in time where you could tell like your ear is full, or there's ringing in the ear and you have to chew gum, or you have to chew something, or you got to do this, like you have to do that. You have to do something to try to get your equilibrium again. So cranial nerve 7 and cranial nerve 5 and also the vagus nerve are involved with proper eustachian tube function. When the eustachian tube isn't opening or closing normally, then the pressure on this ear and the pressure on this ear is going to be different. And once you have a difference in pressure, then it means your horizontal gaze is affected and you can get lightheaded, you can get ringing in the ears, you can get vertigo. So the easiest thing to do by yourself when you have new onset vertigo is think to yourself, do I have ear fullness? Do I have ringing in the ears in the one ear? And if that's true, then probably the diagnosis that you have is your eustachian tube isn't opening or closing normally. Now, what causes the eustachian tube not to open or close normally can be as simple as you got a wheat allergy or you have a dairy allergy, right? Because the eustachian tube goes into the throat and your tonsils and other inflammatory tissue are right there. So if they're swollen, that can block the eustachian tube there. That's kind of my issue. Like I love cheese. I married a gourmet cook, which is Marion. So not that we have excessive amounts of cheese or dairy, but it's hard to not eat it even though you're allergic to it. But if I eat too much of it, then on my right side, not my left side, I'll get ringing. So then I have to do certain things. This is my personal Eustachi. You can see that. It's just a simple device. You can get it at any of the pharmacies. You can get it at Walmart, Kmart, all the different places. So you could hear it. So you close this. Now I'm gonna vibrate here. Then you gotta swallow. So I did 3, that's normally what I do. This one, the ear drum, you could feel it popping. So in other words, this eustachian tube is opening and closing normally. This one right now, it was a little bit. So in other words, again, it's my right side. So my eustachian tube is opening and closing a little bit. There are days where it doesn't open at all. So in other words, that'd be days where I probably ate too many inflammatory foods. So this is one method to try to get your eustachian tube to open and close normally. So that was one reason. And then, normally when you have an infection or something, you got a sore throat, just know, that can inflame the tonsils, and then of course the eustachian tube can't open and close. But normally it's neurologic. Another thing you can do is just wear a cervical collar. And normally we would place people in a cervical collar and either have them in the neutral position or try looking 10 feet in front of them and just wear the collar and see if the internal spinning, the vertigo, the dizziness, or the ringing in the ears subsides. Because that would be, again, a good diagnostic clue that that's actually the cause. And the way we diagnose upper cervical instability causing the problem is by digital motion x-ray. We have the person move and see if there's the excessive movements of the bone. This is from a study. This is from a study from 2003. They evaluated 110 patients with spontaneous rotational vertigo. So in other words, you rotate the head in a certain way and then they get spinning. So that's another clue that the neck is the cause of the vertigo, or the neck is the cause of the tinnitus, or the neck is the cause of the dizziness. For instance, if a person has a certain orientation of the head and then there's a sensation of spinning, then you have to think that it's related to the neck. Or if a person sits up and they walk around and they get a symptom like lightheadedness, ringing in the ears, but when you lay down and it's better, again, you got to think that, well, when I lay down, all the pressure's off of my neck, off of my cervical vertebrae. So that would be a clue that the cause of it is the neck. If you have spinning or vertigo and you also know that you have clicking, grinding, popping in your neck, it occurred after a car accident or kind of a manipulation, or you you have a forward head posture and you're on the computer all day and that's stretching out the ligaments, then you have to think that the cause is related to the neck. So people saw the physician for vertigo, but look at this, 82% had ear fullness, 81% had cold extremities, 64% fainting, 90% fatigue, 97% had lightheadedness. That's why you guys know I think it's a continuum. Like if you just have lightheadedness and all these things are progressive, because ligament laxity is a progressive disorder. It starts with one segment being loose, so adjacent vertebrae are moving too much, then eventually the next vertebrae segment, vertebral motion segment, is going to get loose, then eventually the curve is going to collapse. And I call the breakdown of the cervical curve cervical destructure. Once that occurs, it can affect a myriad of things, because all this cellular activity causes, I just call it cellular poop, which maybe I could come up with a better term than cellular poop, but cells poop, and all that stuff has to get out of the area. So the ear does it by the Eustachian tube. So if your Eustachian tube isn't working, the fluid builds up. Guess what? Sound goes into the ear, then all of a sudden there's all this fluid, then you're going to feel ear fullness. You're going to feel ear fullness like I can't hear as good out of this ear as this ear. So that's what causes it. And it's been so bad that we've had patients where we've done treatment on them. We correct their curve by dynamic orthoneurologic correction, curve correction. Then we do prolotherapy. They get stability, the alignment's good, all the neurology gets back to normal, the Eustachian tube opens, the fluid goes out of the inner ear. Guess what? They don't need a hearing aid, or they just can hear so much better than they ever did. And the interesting thing too is once the fluid gets out of the inner ear, you feel a lot of mental clarity. Anybody who's had a blocked ear and then they do something, they jingle it, they stop dairy, they get an adjustment, they get prolotherapy, and all of a sudden the ear drains. It's unbelievable, the mental clarity. Like you just know something changed where, oh my gosh, my fatigue, my mental fatigue goes away, I can now hear good, my lightheadedness goes away. But look at these other symptoms that the people had. They had postural vertigo, meaning that they would be laying down and they're fine, then they get up and then all of a sudden they get vertigo. Again, that's a sign that it's a neck problem, because the blood pressure sensors are in the neck. The carotid sinus, the carotid body here, that's cranial nerve 9 and the vagus nerve. So anybody who has a positional kind of a symptom, they get up and they get lightheaded or their heart goes boom, 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 boom. That's going to be because the neurologic sensors, cranial nerve 9, the glossopharyngeal nerve, and the vagus nerve, cranial nerve 10, the sensors are off. Why are they off? Because the signals through the vagus nerve or the glossopharyngeal nerve are getting blocked. Why? Because they've had breakdown of the cervical curve because of ligament injury. Subjective hearing loss, we talked about. Obviously, if there's fluid here, you're going to get subjective hearing loss. And tinnitus, so tinnitus, subjective hearing loss, ear fullness, all three of those, and vertigo, a lot of times it's just that the Eustachian tube isn't working correctly, and it's not working correctly because the cervical instability is screwing up the nerve inputs to the various cranial nerves that innervate the muscles that open the Eustachian tube. The treatment then, of course, would be to restore the signals into the cranial nerves, cranial nerve 5, 7, 8, 9, 10, by correcting the cervical instability. So the way you correct the cervical instability is, one, get the curve good by curve correction, and then prolotherapy injections into the ligaments that are weakened will cause them to strengthen. And once they strengthen, the cervical curve is improved. Then when the person moves or they go from laying to standing, the vertebral alignment is maintained. and if it's maintained, then the person the balance is normal, the input to the various cranial nerves is normal, the blood pressure sensors work fine, and the symptoms are resolved.